Thank you, Lavanya. See, today I will be shedding light on the topic vitamin D deficiency and homeopathic perspective. So first we will see what is vitamin D. So vitamin D is a fat soluble vitamin which is essential for maintaining good health. There are two types of vitamins are there. One is a fat soluble vitamin, another is a water soluble vitamin. These fat soluble vitamins are the vitamins that dissolve in fat and are stored in the body's fatty tissue and liver. The four fat soluble vitamins are vitamin A, D, K, E. Another one is a water soluble vitamin which dissolve in water and are not stored in the body. So they must be consumed regularly. So we have seen two types of vitamins. One is a fat soluble vitamin, another one is a water soluble vitamin. So vitamin D comes under the fat soluble vitamin. Vitamin D is also known as sunshine vitamin because under the sunshine, the body synthesizes the vitamin D. Vitamin D is produced by our body when our skin is exposed to sunlight. It is also found in certain foods and supplements. Vitamin D plays a crucial role in our overall health, from boosting our mood to strengthening our bones. So, see, there are two types of vitamin D. One is a vitamin D2, another one is a vitamin D3. Vitamin D2 is also called as ergocalciferol, and vitamin D is called as cholecalciferol. Vitamin D3 is more potent. Vitamin D2 we get it from the plant-based sources, for example, mushrooms and fortified foods. While vitamin D3 is found in animal-based sources such as fatty fish, egg yolk, and liver, as well as produced in your skin when exposed to sunlight. See, here we have seen two types of vitamin D. One is a vitamin D2. It is called as ergocalciferol. Another one is a vitamin D3. It is called as cholecalciferol. Vitamin D2 we get it from the plant-based sources, while vitamin D3 we get it from one animal sources and also from the exposure to the sunlight. Both these vitamins are converted into active forms in the body, but D3 is more effective at raising and maintaining vitamin D levels in the bloodstream. Now we'll see what are the key functions of vitamin D. The first one is a bone health. Vitamin D helps your body to absorb calcium and phosphorus, which are crucial for strong bones and teeth. See, even if you eat or even you eat the food which contains more calcium and phosphorus, but if there is a deficiency of vitamin D, then it is not absorbed or digested properly. So vitamin D is essential for calcium and phosphorus absorption. Second one is that the immune support. Vitamin D strengthens the immune system to fight the infection. Third one is a muscle function. Vitamin D supports proper muscle health and function. And one more important thing is a mood regulation. Vitamin D is linked to reducing fatigue and improving the mood. A deficiency in vitamin D can lead to the weak bones like osteoporosis or rickets and increase the risk of infection and chronic diseases. So in this PPT, what we have seen is that key vitamin D is important in absorbing calcium and phosphorus. Second thing is that key vitamin D increases the immune system. Third thing, it is important for the muscle health. And most important thing is that vitamin D is linked to the fatigue or improving the mood. So this is also a very important part. If there is a gross deficiency of vitamin D, it can lead to the osteoporosis or the rickets. Now I will show you the my video on vitamin D. Please watch. Today we are going to study vitamin D deficiency and homeopathy. So vitamin D is essential for maintaining strong and healthy bones, supporting the immune system and playing a role in various bodily functions. If you have a vitamin D deficiency, it is important to address it through a combination of sunlight exposure, supplementation, and dietary changes. Here are some food that are good source of vitamin D. The first one is a fatty fish. Fatty fish such as salmon, mackerel, trout, sardines, and tuna are excellent source of vitamin D. Aim to include this fish in your diet regularly. Cod liver oil. Next one is cod liver oil is very rich source of vitamin D. It is available as a supplement and can be taken in liquid or capsule form. Third one is the egg yolk. Egg yolk contains vitamin D, but the amount can vary. Include eggs in your diet, but keep in mind that the vitamin D content is mostly in the yolk. Next one, fortified foods. Many foods are fortified with vitamin D, including certain dairy products, milk, yogurt, and cheese, then orange juice, and breakfast cereals. Check the labels to ensure they are fortified with vitamin D. Next is mushrooms. Additionally, exposure to sunlight increases the vitamin D content in the mushroom. It is important to note that it can be challenging to get enough vitamin D through diet alone, especially if you have a deficiency. Sunlight exposure is a crucial natural source of vitamin D as your skin produces it when exposed to the UV rays. Spending about 10 to 30 minutes in the sun a few times a week can help boost your vitamin D levels. However, if you have difficulty getting enough vitamin D through sunlight and diet, your physician may recommend vitamin D supplement. Vitamin D is a vital nutrient that plays a crucial role in various physiological processes in the body, including bone health, immune functions, and regulation of calcium and phosphorus levels. Deficiency in vitamin D can lead to various health problems such as bone disorders, weakened immune system, and increased risk of chronic diseases. Homeopathy, on the other hand, is a system of alternative medicine that is based on the principle of like cures like. It involves the use of highly diluted substances, often in the form of plant, minerals, or animal extracts, to stimulate the body's natural healing processes. Homeopathy aims to treat the whole person, considering their physical, mental, and emotional well being. In the context of vitamin D deficiency, homeopathic practitioners may approach the issue holistically. They may consider various factors, including the individual's overall health, lifestyle, and specific symptoms associated with the deficiency. Some homeopathic remedies that are commonly used to address conditions related to vitamin D deficiency include The first one is a Calcarea calm. This remedy is often considered for individuals who are prone to calcium and vitamin D deficiencies. It may be recommended for those with weak bones and a tendency to gain weight easily. Calcarea patient is fat, fair, flabby, perspiring, and cold. Next medicine is a Calcarea Fos. This remedy is sometimes used for individuals who have difficulty in absorbing calcium and vitamin D. It is thought to support bone health and growth. Calcarea Fos patient is anemic, dark complexion, dark hair, and eyes, thin, spare subject instead of fat. Next important medicine is Silicea. This remedy is believed to help the body in utilizing calcium effectively and may be considered for individuals with weakened bone and poor absorption of nutrients. Chili patient. Patient is very offensive sweaty on especially on the hand and feet. If you suspect a vitamin D deficiency, it's crucial to consult with a physician for proper diagnosis and treatment. Thank you. Thank you for watching the video. Thank you for watching the video. Now we will see vitamin D deficiency with miasmatic background. See, in homeopathy, miasm represents underlying predisposition or constitutional tendencies that can lead to the diseases. So we all know there are three main miasms are there. One is the sora, second one is the psychosis, and third one is the syphilis. Sora represents deficiency, weakness. Psychosis represents excess or overgrowth. And the third one is the syphilis, which represent destruction or degeneration. Now the first one is a SORA. Now the deficiency in vitamin D can be linked to SORA. It is a deficiency as it represents a lack of deficiencies. The remedies for this are Calcarea calm, Calcarea Fos, and Silicea. Another miasm, second one is a psychosis. Excessive intake or over supplementation of vitamin D can lead to psychosis. The medicines are Thuja, Lidorinum, and Graphites. The next miasm is a syphilis. Severe long-standing vitamin D deficiency can lead to syphilitic miasms. And the medicines are Mercurius or Merxol or a mate, and the next medicine is a Syphilinum. Now see what is the homeopathic approach related to vitamin D deficiency. See, homeopathy is a holistic science or holistic system. So homeopathy takes a holistic approach to treating vitamin D deficiency, aiming to address the underlying causes rather than simply supplementing with vitamin D. While homeopathic remedies are not a substitute for adequate sunlight exposure or dietary intake of vitamin D, they may help improve calcium absorption, boost immunity, and enhance overall health. Now we will see some of the how this vitamin D is represented in the repertory. So here are some homeopathic repertory rubrics related to vitamin D deficiency. The first we'll see the general rubric. See, in vitamin D deficiency, there is a fatigue or there is a weakness. So if you want to see in the Kent's repertory, you will find under the chapter generalities on page number 1413, the rubric is general weakness. So one is a weakness. So this is a symptom of vitamin D deficiency. Second one is a bone related rubrics. So in vitamin D deficiency, you get a bony pain also. So bone pain, where you will see the bone pain in, you will find in Kent's repertory extremities chapter. Pain bones, page number is 14 or 1047. The medicines are asafoetida, euphorium perfoliatum, Merck salt, nitric acid, naxomica, phosphoric acid, pulsatilla, pyrogen, and ruta. The next one, we have seen the vitamin D complication. One complication is rickets. So you will find rickets rubric in Boric's repertory under the chapter generalities on page number 966. The medicines given are arsenic, calcarea carb, calcarea phos, iodine, phosphoric acid, phosphorus, and tuberculin. Next rubric related to bone is bone softening of. We go through the Kent's repertory, chapter extremities. In the chapter extremities, you will find softness of bone. The medicine first, you will find softness of femur. The medicine given is silicia. Then softness of tibia. The medicine given is guaiacum. Now, first we have seen general rubrics, then we have seen the bone related rubrics. Now we will see the muscle related rubrics. In that, you will find again extremity chapter, weakness, in Kent's repertory, page number 1224. Now we'll see the mental and emotional rubrics. You will find under the chapter Kent's repertory, depression, melancholy. Here you will find sadness on page number 75. Now we'll see what are the, see we have seen so many medicines under the chapter or under the repertory, but three important medicines you should know right now is the one is a calcarea carb, second one is a calcarea phos, and third one is a silicia. Even in calcarea carb, if you go through the Kent's Materia Medica, he has mentioned the Lyme babies. Say now there is a fad of giving continuously calcium supplement, vitamin D supplement. So Kent once mentions that those babies who take continuously the calcium, they become the Lyme babies. So in such condition, you can prescribe the medicine calcarea carb. So in calcarea carb, what are the symptoms? What we will find is useful for the weak bones. There is a fatigue, excessive sweating you will find in calcarea carb. We know the constitution, fat, fair, flabby, that the chili patient. Then comes the calcarea phos, which is useful medicine for the bone growth or repair, especially in the children, rickets, or weak spine. So this calcarea phos is useful for delayed teething or fractures that heal slowly. The next important medicine is a silicia for fragile bones, recurring infection. See, in silicia, you will find poor assimilation. Then there is a sweat, there is a foul sweat, mainly on the palms and soles, commonly used in individuals with low stamina and sensitivity to cold. Now we will come to the concluding part. Before we conclude, I would like to extend my heartfelt gratitude to Dr. Lavanya for inviting me. I would also like to thank all India Homeopathic Students and Youth Association for organizing this wonderful platform that brings together professionals and enthusiasts to share knowledge and advance in the field of homeopathy. Lastly, I want to thank each one of you for your time, attention, and active participation. It has been an absolute pleasure to share the knowledge with you all. Thank you. Thank you, Lavanya.
Thank you, sir. Thank you so much for the extensive support and the extensive session. Respected participants, the question and answer sessions is open for all. So you guys can ask the questions whichever pertaining you feel. Yeah. Sir, I have a question, sir.
Yes.
Actually, what are the like main investigations which we were needed to check it out the vitamin D deficiency levels, sir?
Directly, we can go for the vitamin D3 level. We can check in the blood. It is a blood investigation that we can do it. Generally, what we do now, vitamin B12 and vitamin D3 nowadays.
Yes,
So
sir.
it is a serum vitamin D3 level. You can go and check it from the lab.
Yes, sir. What
Yeah.
are the main
One thing I
sources,
wanted,
sir?
huh?
What are the main other sources, sir?
See, in vitamin D now, so generally what we have seen is the D2 and D3 two are there. So D2 we get it from the plants. I mean generally the plant sources are there, generally for the from the mushrooms. And vitamin D3 we get it from the animal sources, like the seafood is the main source. Second important thing is the milk derivatives, like milk, curd, buttermilk, then comes the cheese and paneer. So you should include the some vitamin or the milk derivatives in your food. And the next important thing is that as we are staying in India, there is a lot of sunlight. Still, we find many cases of vitamin D deficiency. So exposure to sun. Nowadays, the lifestyle has become in such a way that we stay more at home only. So we don't get ample sunlight. So you must take the sunlight. Early morning sunlight is very important. To go for a walk, automatically you will get a sunlight also. So exposure to sunlight is very essential. Then dairy products are very important. Third thing is the seafood is also good source of vitamin D.
Yes, sir. And there is a question from the participant, sir. Uh, Effect of vitamin D deficiency on hair, sir.
Second of
Hello,
all,
sir.
what you can say, the overall health, how it affects the bones. Again, same thing where there is a see, vitamin D. Hello, I'm audible. Hello.
Yes, sir. You are audible, sir. Not on health, sir. On hair, sir.
Hair,
Hair.
that's what I'm telling you. See, not only hair, it affects all over the body. See, vitamin D is that's what I told you. Ki vitamin D is essential for calcium and phosphorus absorption. Even you take a food which is rich in calcium and phosphorus, but if there is a deficiency of vitamin D, then it is not absorbed properly. So here is again the one thing is that you need a good supplementation. Good intake of food should be there. So that's why vitamin D is essential for the overall health, including hairs.
Okay, sir.
Hmm.
Sir, and one of the participant is also asking the potency and the reputation, sir.
So, but vitamin D is a supplement. So, vitamin D in homeopathy, we don't have directly vitamin D. So, we prescribe the constitutional medicine or individual line of treatment is there. So, what medicines they does, they help the proper absorption of the food. You might be having consuming good amount of dairy foods or the animal food also. But when you take the homeopathic medicine, it is absorbed and digested properly. So that system gets corrected by homeopathic medicines. So homeopathic medicine, 10 people are having vitamin D deficiency, they may require a different medicine. So it is totally an individualized like of treatment is there. So medicine should be given on the personality basis. So there is a vitamin D deficiency. So you need the proper diet, proper exposure to sunlight, and plus homeopathic medicines.
Sure, sir. Sir, one of the participant is asking the dosage which is required for below 5 years a year, 5 years of age children, sir.
If you go,
Vitamin
yes,
vitamin D vitamin D
vitamin D,
supplement, sir.
vitamin D supplement, so you can go through the that is not the homeopathic perspective. You can go through the allopathic doctor and that you take it because there is a standard criteria is there. But in homeopathy, what I can suggest if you go through the medicine criteria card, see there he has mentioned that you can repeat this medicine frequently in children, but not you should not repeat this medicine, especially in elder people. So what I will advise you, instead of taking other supplements, you take the natural diet and you take the homeopathic medicines.
Okay, sir.
So that will be
Uh,
the best thing, huh?
yes, sir. Sir, there is a question from the participant, sir. If
Hmm.
we can give calcarea phos in 6x potency, then it will increase calcium level in body or not? This is the question,
Absolutely.
sir.
See, the theme of biochemic medicine is, see, 6x is a biochemic medicine. The theme is that when the biochemic medicines are given, when either there is a deficiency or there is a disturbed molecular motion of calcarea phos in the body, that is corrected after giving calcarea phos. So you should go through the calcarea phos. You should know the symptoms of calcarea phos. You should know the difference between calcarea carb and calcarea phos. Calcarea carb is fair, fat, flaggy, and the calcarea phos patient is a dark complexion and thin persons are there. So calcarea phos and calcarea carb, both the medicines are useful for the vitamin D deficiency. You can use calcarea phos for the children especially. It is a good medicine.
Yes, sir. Sir, there is another question, sir. Actually, the question is vitamin D deficiency causes hair fall? Like that, this is the question, sir.
What I'm telling you now, vitamin D affects all over the body, can
Okay.
cause. So, in what
Yes.
we believe in homeopathy is everything should be corrected properly. So,
Oh.
including the hairs also, but it can
Mm.
affect. It can affect. That's what I told you. Calcium and phosphorus is needed for the hair growth also.
Okay, sir.
Once you take vitamin D, that is absorbed properly, and it gets the good nutrition for the hairs.
Yes, sir.
Vitamin
Sir,
essential.
yes, sir. Sorry to interrupt, sir. Yes, sir. Sir, how about the role of hormonal insufficiency in vitamin D deficiency, sir? What about the role of hormonal insufficiency, sir?
See, so this is totally a different thing is there.
Okay, sir.
We are going now, we are seeing the one is a modern, see what happens in homeopathy. One is a modern medicine is there. And second
Mm.
thing, the homeopathic approach is there. If
Mm.
you go through the modern approach, the approach is totally different is there. There you
Mm.
go on giving the supplement, they will advise you to go on taking the medicine. In homeopathy, again, we don't go for the disease, hormonal imbalances, or any other hairs like that. We prescribe basically only on the constitutional medicines. So that's what I'm telling you. Again, the same thing is there for hormones also. The same thing is there. We have to prescribe the medicine only on the constitutional basis or individual line of treatment, taking into consideration mental, physical, and emotional symptoms. So that is the baseline option. So accordingly, so we can go through all the same things are there. Hormones are there, hairs are there, bones are there, then teeth are there. Everywhere it affects. So what I will advise you is that take a proper diet, then take the sunlight, and third thing is that you take the homeopathic proper medicine.
Yes, sir. And sir, one of the two participants have the same question, sir. Actually, the question is, what is the role of biochemics medicine in vitamin D deficiency? That is there. Two participants have
Very
asked
good,
the same
very good,
question.
very good, very good. See what I have seen in my practice also, biochemic medicines are very useful. Especially now we have seen the two medicines. One is the calcarea phos and second one is the silicea. So
Okay,
you
sir.
can use this both the medicines in 6x potency. You can prescribe in children repeatedly. In adults, just take the proper case and then you prescribe. But you can use these both the medicines. Sedation also, I have told you the symptoms of sedation also. Sedation, there is a poor assimilation. There is a sweat is there. The sweat is little offensive. Sweat mainly on the palms and soles. So that is also one thing is there. Instead of taking more supplements in modern medicine, you can use calcarea phos and silicia.
Yes, sir. Sir, there are another couple of questions, sir. What is the standard criteria of allopathy doctors for the prescription of that vitamin D, sir? Whether they are prescribing the supplements, what is the standard criteria they might be following, sir? This is the question, sir.
That you can go through in the literature, because I'm not expert in that. Whatever the dosage, what I believe. See, that's what I gave you the example of Calcarea cough, especially
Yes.
by Kent. What he has told. Kent says that if you go to the doctors, or go if you just see the prescription of children's, there is a continuously the calcium is prescribed to the children's from their birth onwards only. So Kent, what he says, ki they become the line babies. So if such type of patient comes to you, you prescribe Kalkiriaka. So when people they take lots of calcium and they come to you, you prescribe Kalkiriaka. Then children especially, this sentence is told by the Dr. Kent only. If you want allopathic doses of the modern medicine doses, that I'm not expert in that.
Okay, sir.
What I will advise you the natural diet, sunlight, and homeopathic medicine.
Yes, sir. Definitely, sir. Sir, the last question, sir. I think, I hope. Sir, along with the constitutional treatment, do you recommend vitamin D supplements or only constitutional remedy, or any mother tinctures do you recommend?
What see, mother tincture is okay. You can prescribe mother tincture if it is needed
Mm.
according to the symptoms. And suppose there is osteoporosis, complication is there, rickets is there. So what I will advise you as a homeopathic doctor is that you take proper diet which contains more vitamin D. Once you take proper diet and you have a symptom, you take the homeopathic medicines, then that is absorbed properly and that reaches to the part properly. That system is corrected. So three things again I will repeat again. One is a diet rich in vitamin D. Second thing is a exposure to sunlight. And third thing is homeopathic medicines.
Definitely, sir. It's a great opportunity to have you in the on the board, sir, with us. And respected participants, any other questions from your side? You can put it in the chat box. I hope they have cleared all the questions, it seems, sir.
Yes, yes. Thank you. It was a very nice question session. But only thing is that the modern medicine doses I cannot tell you right now because I don't prescribe that medicines. So that's why I told you prefer homeopathic medicines and the auxiliary line of treatment like biochemical medicines you can.
Definitely, sir. Respected participants, many times constitution does not what. Sir, one question, sir. Many times constitutional remedy does not help. What to do the next step? This is the question, sir.
Yes. See, sometimes what happens, sometimes you prescribe the medicine, but that medicine may not be a constitutional medicine. That will be a deep acting medicine covering the maximum number of symptoms. At that time, you prescribe that medicine. Once the patient feels better, and then next time you can prescribe the constitutional medicine. Got it?
Yes, sir.
So first, we take the case, prescribe the medicine according to the signs and symptoms. Then you can that will be a very deep acting medicine considering the maximum number of symptoms that you prescribe, and then next time you can prescribe the constitutional medicine so that the person will not fall sick again and again.
Yes, sir. Sir, actually, this is the question from my side, sir. Actually, what is the eternal criteria that one can recognize that a person is having vitamin D deficiency? Like, if we saw a person, sir, ऐसा उनको like we can at least somewhat we can judge like is
Yes,
this
yes,
person
yes.
eternal
Yes.
based.
Now the very simple thing is that sometimes you feel, "Arey, your mood is why you are feeling so low, why you are feeling so nervous, why you are feeling so weak and tired." So not necessary that it should be a totally a mind related. It could be a deficiency of vitamin D. That is a one more important thing is that that vitamin D causes the sadness, fatigue, weak feeling. So that one important one, this is the most important symptom you can go through the for the vitamin D also instead of judging all other things. So one thing is that ki there is a weakness, there is a fatigue, there is a you feel sad. So this is a mood, or the mood goes low, low feeling is there. That is a one important symptom of vitamin D deficiency. Then muscle pain, bone pain. This is also a very important symptom. So there is a continue when you get up in the morning, there is a tired feeling is there. So the bones they pain, muscles they pain, you feel tired, you feel fatigue. So this is all important. The person is having, if you go nowadays, the modern tests are there. If you see that there is a osteoporosis, again, you can go and check the vitamin D levels also.
Yes, sir. Sir, actually, one participant is asking regarding the any sites or any statistical data available which is pertaining to the effect of homeopathy treatment in curing vitamin D deficiency.
That you will have to go through that I have not checked it, but
Okay,
could be,
sir.
it could be available.
Yes, sir. Like sites we can have, no, sir.
We
Google
can go
Scholar,
to the
PubMed.
website and check it because it could be, definitely it would be available.
Yes, yes, sir. Yes, sir. Yes, sir. Thank you all. Thank you so much.